Welcome, everybody, to another podcast. This is our Firehouse Table Talk podcast brought to you by One Brother, One Sister and recorded right here in Sober Life Studios. If you have any questions about One Brother, One Sister, go to onebrother1sister.com. Always looking for help and donations so that we can provide training and education to first responders all over. And we appreciate your help. Also, don't forget to like and share this with your friends. I have such a great thing. I mean, this is a special show today because we got so many people in the studio and we're like, it's already hot and sweaty in here. So we may get a little crazy before the end. All right. But we got great people here from the Broward County Department of Health. And to help me with all of this is my good friend, Juan Velez, captain from Lauderhill Fire Department. Juan, how you doing, brother?
I'm doing pretty good, Scott. Good to see you. Thank you for having us.
It's good to see you, too. We're at like other ends of the great table here.
There's a reason for that.
Yeah, this is how we keep the guests from escaping.
That's it.
Right?
That's exactly
you know,
right.
they want to get up and run. We got to keep them together. But Juan, you're doing well. We're going into the holidays. Any message out there from Lauderhill Fire Department for all the people out there for the holidays?
Make sure the turkey's defrosted before you throw it in the oil because it can explode. And the rest is safe out there. Happy holidays.
All right. Whether you're cooking for Thanksgiving, Christmas, the New Year's, or anything, always keep an eye on that stuff. Now, from the Department of Health, we've got, of course, Chris and Cecilia. I'd like them to tell you about what they do and what they're all about. So, Chris, tell us about who you are and what you do, buddy.
Well, happy to be here. Thanks for having us, Scott. I am the co-responder program coordinator and harm reduction lead over at the Department of Health in Broward County. And I work under the wonderful Cecilia Gonzalez, who's my boss, and has put together and run the show and the reason for most of our success so far.
She's your boss.
She's my boss.
She's way too nice to be a boss.
She really is.
You know, or is that just on the outside?
I get that a lot.
Do you get that?
I get that a lot.
Well, Chris, it's great to have you here. You and I have done some stuff before. We've gotten to know each other a little bit.
Yep.
So it's a pleasure having you, Cecilia. First
Hi.
time meeting. And tell
Yes,
me about
sir.
yourself.
Hi, Scott. Well, again, like Chris said, thank you so much for having us here. It's a pleasure. My name is Cecilia Gonzalez, and I am the manager for the Overdose Data to Action at the Florida Department of Health in Broward County. My department oversees overdoses in Broward County. In particular, what we're going to talk about today is our co-responder model.
Okay, terrific. And the overdose data to action. Is this something new? Just before we get into it, I know we're going to talk about some things. Is this something relatively new? Because I haven't heard of it a lot before.
In Broward County, yes, but nationwide, it's been used. We're actually trying to catch up to what they're doing in other states. We're trying to get that down here to Florida, and I will say that we're doing pretty good. We're off to a very strong start.
So we're talking about the overdose data to action plan. It probably sounds more complicated than it is. So we're going to find out about it. But what inspired Broward County's launch of this program?
Yes. So DOH Broward launched the OD2A co-responder model program because we saw that there was a real need in the community to kind of fill in the gaps between emergency care and long-term support. So there's individuals out there that, unfortunately have this addiction problem and want help. But what's happening is that they go to the hospitals treat them at the moment, but then what happens afterwards? Where's the support? Where's the referrals? That doesn't exist. So we want to close that gap and we want to catch it from the moment it happens and guide them, hold their hand and tell them, look, we're here for you. Doesn't matter what it is. Doesn't matter how many times you've been in the ER. We're going to help you.
Wow. Well, so it's a much kinder program than the clinical terms that's used for, the overdose data action.
Yes.
It sounds very technical, but it's about human beings.
It is. And it's showing them that we care and we're here for them and we're not judging. We're going to remove stigma from this. Because at the end of the day, that's really what it is.
Oh, thank goodness! Yes, absolutely. Juan, you're a first responder, and you're also, I guess they call it a co-responder. How does a co-responder work in the real time in this program?
So this is thank you to Cecilia and Chris in the Department of Health and CDC and OD2A money. We're going into our second year. So the first year we learned a lot, and we're just starting to implement it. So technically the way is being structured is that we have developed a network with the social workers, hospitals, also the treatment centers, and we have a referral system. One of the ways they get referred is our crews go to a call, like an overdose, right? or substance use, somebody asking for help. We have a referral system that sends back the referral back to us. We make contact with them at the hospital. If they're willing to go in from the hospital, we can get them into a treatment that same day, right? We're on the spot. Because when you're vulnerable, that's first 72 hours. And that's our time frame. From discharge to them getting home, we got 72 hours to go visit them.
Well, and being in a community, usually it takes a lot longer than
Yeah.
to get somebody help. So this is a game changer.
It does make a big difference because, like Cecilia was stated, there's the way it was done before sometimes it works, but sometimes it doesn't work. So they used to give somebody a referral, and then it would say, hey, show up over here, but this person might have come in to get treatment assistance, and then you get that piece of paper, you're probably going to leave there and go self-medicate once again. So it's making a big difference. We've had a lot of success stories that we can share with you.
That's fantastic. We'll talk about a few coming up, I'm sure, because there's some things we want to talk about. Chris, I got to ask you, though, having 8 different, and I believe this is correct, 8 different EMS agencies involved in this. What does that say about the community and the commitment to this?
I mean, I think it's kind of shows the unprecedented support where people are moving and shifting the paradigm from just standing by and allowing it to happen to taking an active stance in the community, especially in our law enforcement and EMS fire rescue co-responder model, where they're taking it upon themselves to integrate into their everyday responsibilities a way to enact with the community to effectively change and save lives. Whereas before, this was something that never was even considered.
That's got to excite you guys in the office that so many people are involved and that they're jumping in all the way. I mean, it's good energy, correct?
Oh, yeah.
Absolutely. It's a community effort.
It has to be.
Yes.
It's a community problem. It has to be a community effort for sure. So what kind of impacts are we seeing so far? Are we seeing any real impact, real-time things going on? Either any of you guys.
Yeah, absolutely. The data that we were able to gather is going to be pretty impressive. Yeah, we've seen a lot of again, like people that are leaving the hospital and thus make contact, and then send them to a community to get a resident to get residential place to get treatment, right? A detox first and residential treatment. But we've had, and I'll share a little story that we had probably about a month and a half or so ago. We had a case that came out of Sunrise, City of Sunrise, with a gentleman that had surgery back in the day, and then unfortunately he kind of went through the unfortunate addiction, and then also got put on some medication.
Yeah,
he had never had any kind of counseling. Just was given the medication, right? The medication to get him off the addictive drug. Between Lieutenant Winters from Sunrise Fire Rescue, which he also runs a program similar to what we do, and also Dr. Perez from Lauderhill Hospital, psychologist, Lauderhill PD, which is a psychologist that works with the system, and South Florida Wellness Network. We were able to. I've done one-on-one interventions and got pretty good at it, right? But I've never done a family setting one, and that was pretty interesting. It took about 3.5 hours, started from the gentleman saying no, absolutely not, to 3 hours later packing his stuff, and we got him into treatment. He left treatment recently and was discharged on a Thursday. He was back at work on Tuesday, very happy. He said he had no idea that this was a process that is in place now. And I think a lot of people are traumatized when we watching the movies, how people go cold turkey, and that's not the way it is anymore. You have these facilities that have actually set the program pretty well for as far as making you comfortable, and went to detox you, went to induce you with the Suboxone. So we've had a lot of good stories, a lot of successful stories, because they have no idea. Broward County, we're a very resource rich county, even more than our neighboring counties. So I hear that what works is the connection of the resources. And a lot of people are running parallel. They don't know that there's resources out here, but there's a lot. We're very fortunate.
That's excellent.
Yeah, and historically, most of the agencies, specifically in Broward County, have always operated in silos. So, one EMS fire rescue agency, perhaps on the east side of Broward County, and you have another on the west for example, Sunrise, didn't communicate and speak to each other on a real-time basis about overdoses and what's going on in their community. Now, the Department of Health has kind of quarterbacked and become the central hub where these multiple EMS agencies, and actually we have 4 that are with us, including Lauderhill was the first, with 5 more to onboard this coming second round. And we're hoping to have one synergistic umbrella co-responder team where all the agencies have full coverage of Broward County 365, 7 days a week, 24/7, so that we can intercept the individuals in our community that need us the most.
That's incredible. And the more people that sign on, it's kind of like we're attacking this thing with a united front, as opposed to all separate entities and nobody knows what anybody's doing. So that's important. Juan, you also made a point. I just want to make it clear to all of our listeners out there. If you know somebody who has an addiction problem or something like that, detox could be very, very dangerous. Make sure you call a professional, get some help. Juan, you mentioned it, that doing it alone is very, very, it's dangerous.
Absolutely.
So we want to make sure that point is very clear. Let's get back to the program, though. This kind of partnership and stuff, Juan, are you seeing this making a difference?
Yeah, absolutely. Absolutely. And again, I mentioned the resources are here, right? That we just, so people just don't know. So a lot of the organizations out here trying to do something, they're trying to duplicate something that's already out here by going to this conferences and committees. I use one as an example that the Department of Health hosts, which is the OFR, which is the Overdose Fatality Review Committee that is chaired by Veronica Trejo. It's an amazing committee to be part of, right? Because in the room you have CDC, you have hospitals, you have treatment centers, you have detox places, and all the teams that you see from the fire rescue, we're all in there. So we have all the resources are in the room. DSO,
Medical examiner's office.
Director Sharp, medical examiner, toxicologist, epidemiologist. And literally in the room, we review some cases. So unfortunate cases have happened in our community, but where the system broke down. And then we were able to give a lot of input. It's a very
imagine having all the key players all together and reviewing what went wrong, what could have happened, how can we do better, and then coming up with a solution at that moment, or coming up with recommendations. So where did the system fail the individual? Yeah. That's where we come in. Like, we don't want this to happen to the next person. So we come up with recommendations, and we, like Juan's saying, our community partners are so crucial to this, because if we need to call Lauderhill, we need to call Fort Lauderdale. Whoever we need to call, it's just a phone call away. Say, look, we heard about this. How can you help?
Just a sideways moment here, guys. I just got to say that you mentioned it's about 2 years old, or a little less than 2 years old.
We're entering our second year now.
Were you expecting this kind of good response? I mean, personally, because you seem like you're very invested in this.
I am.
And as you all are, I'm sure.
We are.
But I'm looking at you, and you're lighting up with the stories. And
yes.
Were you expecting this kind of response?
I was, because of the team that we have.
There we go.
Yes.
There we go. Great people.
Yes.
Great. Now, I got to ask, because it says, and I want to get it right, overdose data to action plan. Yes. Data. That seems like, okay, we're going out there, we're helping people, we're doing this, we're doing that. You got people like Juan and all these great agencies, the EMSs, they're all doing it. What's with the data? What does that do for us?
Well, Scott, the data is the backbone. It's the key to the entire program, the operation of success. The name says it all. Overdose data to action, which means we're not collecting data and just holding on to it just for the purpose of observing. Mm-hmm. We are taking that data, we're analyzing it, we're giving it to our experts, whether it's the epidemiologists who are running the biostatistics and biospatial surveillance. We're giving it to our data analysis, our ME and toxicologist reports. They're looking at all sorts of data sets, and then they're tracking emerging patterns on new drugs that are in the community, like nitazines and cathodones, which is bath salts, things that weren't around 2 or 3 decades ago, and are plaguing the community. The data is what's shaping us to be able to say, this is where we need to move resources. This is where we need to move the co-responder team, because this is the hotspot. This is the problem. And then we move in and we integrate, we apply, and then we remeasure and we check to see how are we doing, engage that in the community response.
Wow.
Just to piggyback on Chris. So our surveillance team's able to pull data to see what zip codes have the highest hotspots. And then we can target those hotspots, get more help for them. Whether it's harm reduction, whether it's mental health, whatever it needs, we can target those areas.
So identifying these patterns, either in location or in the new drugs on the market or in, maybe clusters of what's going on over here, that can help not just with people who are in trouble, but maybe even preventative measures, I would
Absolutely.
say, right?
100%.
We know where to put the effort.
If you consider back then, 10, 15 years ago, let's say cocaine was an issue and it was just cocaine. Now we're finding out that one drug sample can have 15 different components. So we're talking about 15 different drugs that you had no idea that you just purchased are in there. And that's going in your body.
Oh, absolutely. Absolutely.
May I, Scott,
Yes, please.
add something to as far as you spoke about the preventative measures, right? That's another thing that is huge is the data that the Department of Health is collecting is what do they need? What do we connect them with? Whether it was education, food assistance, medical primary care, leave behind Narcan, get them Narcan and educate them on it, right? So they're tracking everything that could bring somebody to that point of self-medicating, right? What socially determinants of health do they need? They need to be addressed because they're here. They just don't know. And another, speaking about Narcan, one of the things that we did with partnership with the Department of Health is that we targeted some of the hotspots and we put Narcan dispensers, right? And we actually got them geotagged to, not geotagged, but we got them tagged to 911.
Okay.
Example, we have a community that has multiple floors and we put the dispensers in the lobby next to the AED and then we tag them to 911. So if somebody calls from the 5th to 6th floor, calls 911 and said, I have an overdose, dispatcher recognizes a dispenser box with multiple kits. And it tells them where it is, gives them instructions, and the response for fire rescue is now addressed. Hopefully, with the Narcan administration, because you look at this type of programs, right? The brain starts dying in 4 minutes, and then at 6 minutes is permanent, right? So when you can address preventatively by giving somebody the instructions and the Narcan to administer, that 6 minute response time, which is the standard, it's told you start dying at 4 and it's permanent at 6. So no matter what we do as fire rescue to the resident, we might bring them back, but their brain is no longer there. So the initiatives are really very effective.
Time is everything.
Yes, sir.
Time is everything. Now you're talking about using these things in the community. I'm wondering, has there been community feedback and has that influenced what you're doing or helped you guys kind of shape where you're going with this?
Can I just one story related to that?
Sure.
So we monitor our boxes. I apologize, just a little quick story. Because to me, is they are.
Hey, we invited Juan on the show. The stories are going to happen. He's got too many for us.
Well, as you can tell, Chris comes and Cecilia come with the data, experience, the research. I come with lived experience.
That's why it works.
And Scott, by the way, not to interrupt Mr. Velez, but he was nominated for humanitarian award. When was that one?
Yeah, last year.
Yes.
It's coming. It's
next
year, by the way. Right?
Yes.
Thanks, Chris.
So,
Thanks.
Yes.
Appreciate it.
It's amazing.
Thank you. So the quick story. You talking about the feedback and this stuff, right? So our team monitors our boxes, our Narcan boxes, and I went to refill one that is always low, and a resident approached me and said, "Hey, can I have some of those boxes?" And I'm like, "Absolutely. Do you know where it is?" She goes, "It's Narcan." I said, "You know how to use it?" And she goes, "Yes, for synthetic opiates and pain medication overdoses." And then I asked her again, "Do you know how to use it?" She goes, "What do you think your box is always empty?" Because we have a lot of youth that come out here and get in the areas in empty apartment complex or the woods. And she actually used it like 3 times prior to that week. So there's definitely a lot of feedback. I think that is very effective. I think it is effective. I know it's effective from hearing from the residents getting the feedback. So yes.
Wow.
And just to add to that,
Please.
Quan and all of the other EMS agents that we have, they're adding a personal touch to it by doing the follow-ups within 72 hours. That's kind of the crucial window, if you think about it, how vulnerable a person can be. They just got out of the hospital. They're probably craving, to have the next, hit. And here's Quan and his team knocking on their door, just, "Hey, how you doing? How can we help you? What do you need?"
Wow.
So that real human touch and just, "Hey, I'm there for you."
there's so many moving parts to this. That's fantastic. But in the community, we can see where the community's interacting with the people out there doing the work. Has there been any other community involvement or community influence going into what you guys are doing?
Absolutely. I mean, off of our OFR, our overdose fatality review, like Juan and Chris were mentioning, it's a community. So we meet with them on a biweekly basis just to kind of talk about what's going on in the community. Is there any stories to share? Is there something working for another, like for example, South Florida Wellness Network or the Robin Foundation, who do so much for our community?
Yeah.
Again, it's just these key players that are really making a difference and sharing the stories. So we started with 4 EMS agencies, and now we're going to have 9 in total.
Wow. Well, I know that One Brother, One Sister, we're behind you guys all the way with anything we can do. Certainly. What kind of training are there trainings that go along with this? Because you got a lot of moving parts out there. You're coordinating between EMS and community and different things. So what kind of trainings are we throwing out there for people? Or what kind of trainings are you guys getting?
There's a lot. Like I said, there's an abundance of resources, right? So the OFR to all of us is training because they're learning something that they're not. It's not what they do from the fire rescue side, and we learn a lot from them because we're not from that side, right? So they definitely get involved with the committees. One of the things is that I realize more and more, and I hear some of my friends sometimes say, and I have to correct them, is the stigma, right? Everybody thinks somebody's an addict, and nobody puts in place that your mental health, you're losing your wife, divorce, your kid having problems is what gets you there. So I think that taking a lot of classes, you mentioned One Brother, One Sister. I've hosted three training courses at the department, and I've had a lot of good feedback with your course for motivational intervention. Matter of fact, when I did that intervention, I actually utilized a lot of the things I learned from you guys, and also critical de-escalation. So I think that getting the current education helps you a lot. Makes you be more in the moment to help somebody out. Conferences all over the state. There's all kinds of mental health conferences. I know that Cecilia and Chris can share some of those that we also attend.
Yeah, we do. We do every year. We go to Atlanta and we do the OD2A recipient conference, and it's a 3-day event. And we just hear from other jurisdictions, a little bit about what they're doing in other states.
Oh, wow.
Yeah.
Wow. So, I mean, it seems like you guys got a lot done in a short period of time. Am I wrong?
No. We did actually.
Both your eyes got wide. Like, oh yeah, it's been a lot.
I believe, unless something's changed, very recently, that Broward County will be the first co-responder team to have 9 different municipal fire rescue agencies as a part of their co-responder team. So, I mean, that's quite an accomplishment for the Broward County Department of Health and all of its community partners and fire rescue partners. So,
wow.
Yeah, wow. It's been good. It's been good. It's actually it's motivating.
How has this changed EMS and how they will do their jobs? Juan, has this made some changes to how you guys actually operate?
Absolutely.
And I also want to know, does it make you feel more empowered having this program?
Oh, absolutely. We're very fortunate to have the Department of Health bring us in to be part of something that's great because it's working. Look, before even, you hear the word silos all the time, right? So, but I'll use it. Even fire departments were working in silos, right? You would have Fort Lauderdale, Sunrise, and Lauderhill, and they were all trying to do their own thing. Now, having all the departments, 8 of them or 9 of them within Broward County, it's actually brought us together. So it's good. It's great. It's good stuff.
That's fantastic.
I think I forgot the question, Scott. What was the question?
You answered it.
I did. What was it? Can you say? I might have something to add in there.
You were always. I was just saying, how has this influenced the job as EMS, fire rescue?
So another thing that we've done is that we educate our crews, right? Our frontline rescues, the engines. I mean, I was on the frontline rescue till 2 years ago when we started this program. We are educating the crews, and we also leave narcan behind, right, with QR codes. If you respond to an overdose, we tell the crews don't ask too much questions, don't kind of put them in place, leave it behind and say there's a QR code here. But if they ask questions, you can engage them. And we go visit them. So as soon as an overdose happen, whether it's at the hospital, we try to make it to the hospital first. And then when they get discharged, we'll meet the family, see how we can connect the family to support. maybe the family's also been dealing with this for 10, 15 years, and they're at that point where maybe they're done with their family members for that time. And we all know that this family support is huge, right? You remove family support from somebody that's dealing with something, and they're going to go even deeper down, right?
Absolutely.
The community is what kind of assists the person through the process.
Oh, Overdose Day-to-Day Action Plan. It's firing on all cylinders. The Department of Health in Broward County is doing fantastic. You guys are doing great work. Juan, always we appreciate, and we appreciate your service. What's next? It seems like you're kind of at that point where you're going to get so many people involved. Is there a vision beyond this program?
That's our goal, Scott. Our goal is for every EMS agency in Broward County to have access to the co-responder model. We want to sign everybody up. We want this to be a full effect to where everybody's working together as a team, and we're trying to help and connect not only the individuals, but the families to the resources that they need to make it successful.
Wow. Now, it seems like, being as new as you are, it looks like you're trying awful hard to be the gold standard in these programs. And Broward County has a history of when they grab onto something, they do it well. You know, Department of Health and everybody. What's it like? What's the team like that's working on this? What are the people like?
It's a great group. We're about 15 of us in the department in the OD2A program. And like Chris mentioned, we have our lead epi team, we have the surveillance team, we have data analysis, we have linkage to care in the hospitals, we have linkage to care in the jails. So we're trying to help people that, you know, are going to jail, that, you know, when they come out, there's somebody there to help them, there's support there. Because what good is it is you keep going to jail, but you're not getting that help you need.
Right.
We have to break that stigma, break those barriers.
Trying to meet people where they are, you know, not which is truly, I think, the key, because every overdose call should be a doorway to recovery, not just a moment of crisis. So if we can apply this as we move forward in building our vision for the co-responder model and more for our community, we can, you know, effectively intercept and stop the vicious cycle of overdose use and abuse, you know, hopefully in as many individuals as we can.
I want to make that point clear that you just made. This program is not about doing better at dealing with overdoses. This program is about finding out why they're happening, where they're happening, how we can help, and then going beyond that and using that data to create plans where we can stop it from happening. It's not about responding to it's about eliminating the overdose.
Correct.
That's the end goal, obviously.
Absolutely.
Yes.
Obviously. You know, so we're doing all this work, and you guys are out there. Personally, have you seen where the impact is happening? Have you personally, either in the part of your job or something, have you had those moments where you sat back and said, wow, thank God we're doing this? Have you had those moments?
Absolutely.
Yeah.
You know, you see it, you know, in the way people interact with each other, the team environment. People are motivated to do their job. It's not even a job to most of the people I know in this community that work, our community partners. They're there because they want to make a change, not because they're trying to collect a paycheck. I could say personally that every person I've interacted with, you know, especially, you know, on the fire rescue community partner side, all walks, they're in it for the right reasons.
Cecilia,
Yeah.
Same thing. Yeah.
Same thing. Along this whole process, just meeting people that you would probably never meet, or just hearing from family members just say thank you for, you know, not giving up on my son, on my daughter, and just being that person to connect them and not judge them, that makes it all worth it.
Wow.
Yeah.
Juan, I assume, and you're out there in the front line, Juan,
Mm-hmm.
I assume you've had those moments that had a personal impact.
Oh, absolutely. I can stay here till Sunday telling you stories, Scott, but
And
I know Chris will hit me on
we all didn't just fall over.
But one thing I can say and add to this whole thing is the education, right? Like they're educating their family, their mothers, the fathers, the youth. You know, that what back in the day, what was out there is, you know, is what you thought you were doing. Nowadays, you have no idea what's going on. So one of the things we do with the Department of Health also is we do a lot of education to youth.
Yes.
I think in the last probably 3 months, we made contact with probably about over 500 kids from the Boys and Girls Club, from the high schools, from different events through Halloween, anti-bullying, drug education. And you get a lot of these kids, they engage and they'll come and ask because they have no idea. They have no idea what they're taking in from this little stores. They have no idea what they're injecting.
Yeah.
You know, they think it's marijuana, they think it's synthetic stuff, and they're taking in synthetic opiates. They have no idea, and xylazines.
It's
And
the awareness, the
Yeah.
education component of it, because nowadays your kids are given gummies.
And the whole not in my neighborhood. Oh, it's not my kids, so it's not in my neighborhood.
Exactly.
No, it's everybody.
Yeah.
It's everybody. And I've had family members. And my wife, as a matter of fact, died from an overdose. And we've had all of these things. And the interesting thing is after she passed, the state of New Jersey, actually, because she was in Jersey, actually contacted me to ask me because she died from a fentanyl overdose, they were getting data. And I was so happy to see that. So now that we're doing that here, it's amazing. And I know you're a data guy. I know you love your data and you're all about it. Are you surprised at how much data you're actually getting out of all of this?
Surprised? No, but
Excited, I'm sure.
Yeah, I mean, it's exciting because we can use it to affect the change, you know.
Yeah.
And when you see trends, you know, in certain times where are encouraging that drug use is, you know, going down, perhaps because, you know, law enforcement, perhaps because individuals are getting to the right secondary care and they're breaking the cycle for all the right reasons, that's always a good thing.
Absolutely. I'm going to ask people listening, and they want to know more. Is there any way to get more information about the overdose data to action plan?
Absolutely. You guys can feel free to give us a call at the Department of Health, email address, website. We can provide all that.
Okay.
Cecilia's personal number. Hold on a second. And Chris.
And her home address is. She likes visitors at 2 a.m. No. But you invite people to contact the Department of Health,
yes,
ask about it.
Our overdose prevention program, and
Is it on the website? As
it
a
is
matter
on
of
the
fact?
website. Yes,
So if you go to the Broward County Department of Health, you can
absolutely. Yes.
get more information. Are there opportunities for community members to get involved? Are there any opportunities for that?
Absolutely. Yes. Yes.
Okay, so we definitely want to look at that.
There's a lot of committees again in conferences here, right? If you can they go to conferences. One thing I can say is that you can also reach out to the fire departments in the Broward County, even the ones that are not participating, right? They know about our programs. They know about the Department of Health.
Yes.
You can do as well too. Also, if you have questions, don't hesitate to go to the hospitals, right? Go to the hospitals know about this stuff. They'll connect you to somebody. So there's a lot of resources. Also in your city web pages, you can go and look at information because a lot of programs that the community, the cities are putting in place in there that nobody knows about.
Great. Listen, guys, before we wrap up, I want to give everybody one final chance to let people know whatever you want them to know about this program, personally or professionally. Juan, we're going to start with you. We're going to say,
I would just say, you know, us as adults deal with a lot of mental health that gets us in our places and our self-medication. And the stigma is going down. The resources are here for you guys. And another one that you have to stay on top of is your youth, right? Parents, don't put your head in the sandbox. Talk to your kids. Make sure you're monitoring them because our kids are out here. They're spending a lot of time on their phones. There's a lot of stuff out here that we don't know what's going on. So just stay abreast, stay educated. Thank you.
Yes. Yes.
thanks, Juan. Chris, what would you like to say? I'm going to save the boss for last.
I think that this program is incredible. You know, it's because we've had amazing leadership, amazing community partners like Juan and all our fire agencies and law enforcement agencies and community partners. You know, this multi-agency team approach is newer, you know, on the national side and definitely new to Broward County, but I think it's going to be here for a long time. And as we strengthen and adapt and build it out, I believe that having that community prevention mindset instead of a reactionary one is going to be the key to success.
Absolutely. You know, and I have a feeling those few departments that aren't involved are going to be jumping on board really quick because nobody wants to be left out of making a positive change.
Right.
Yes.
Cecilia,
So my message would be to individuals or to the community residents is that you're not alone. There's help. There's a lot of help out there. Don't feel like you have to tackle this by yourself. There's a lot of people that are embarrassed. I've already been down this road and I've offered the help and I messed up and I did it again and now I'm too afraid to ask for help. That's why we're here. We're here to help you. Maybe it didn't work the first time, second time, but it will the third or the fourth.
I know things are tough out there, on and off. I mean, certainly politically, with the addictions out there, a mental health crisis, there's so much going on that when somebody steps up and says, we've got something we want to do, get involved, find out about it. Go to the Broward County Department of Health and learn more about the overdose data to action plan. It's like something I've never seen before. It's finally somebody saying, let's take the tragedy and turn it into information that'll prevent the next one. And we really appreciate it. We appreciate all you guys. Thanks for being here in Sober Life Studios, and thanks for being on Firehouse Table Talk.
Yeah, thank you, Scott. Thank you for having us. Thank you.
Pleasure.
All right, and all of you out there, once again, don't forget, I'll get a tear in my eye if you forget, like this program, subscribe to the channel, and share it with your friends. Firehouse Table Talk, I'm Scott Jones, your host. Thanking you for joining us. We'll catch you next time. Bye-bye.